Welcome everyone to the ICFJ Global Health Crisis Reporting Forum and to our ongoing webinar series, Lessons Learned Reporting on the COVID-19 Pandemic, where we host journalists from around the world who have been covering different angles of this pandemic from exceptionally different contexts. If you don't know me yet, I'm Stella Roque, the Director of Community Engagement at the International Center for Journalists based in Washington, D.C. And joining us today, all the way from Italy, are two investigative reporters from the country's foremost investigative broadcast program, Report, Cataldo Ciccolella and Lucina Paternesi Meloni, to tell us what they learned about getting stories in a country in lockdown when Italy was Europe's COVID-19 epicenter earlier this year. We also slotted Elisa to join us for this event, but she couldn't be here today. However, these two will certainly give us the detailed rundowns of how they got the story in the country at the time. Italy has already had over 35,000 fatalities from COVID-19 and over 300,000 cases just this year. And the country's prime minister is currently considering extending the state of emergency until January 2021. Amid the pandemic earlier this spring, the journalists at Report established a strategy to continue working safely and broadcasting impactful stories. A reminder to the people tuning in, if you have questions during this discussion, please post them on the Zoom chat or in the comments of the Facebook live stream. Once we walk through both stories, we will be taking questions from you. Thank you so much for joining us today. And please, for any of the questions I ask any of you to please contribute to the conversation. And I think we're gonna actually start with Aldo to give us a bit of context. As the pandemic really began to impact the country and the government began to restrict the movement of citizens across different regions of Italy between March and May, were journalists still permitted to travel? And what was the strategy your outlet applied early on to make sure your journalists could continue to report during the lockdown?
Well, yes, journalists were still allowed to travel with permission. So we needed a permission from our executive producer that stated what we were going to do and that we were on a work mission. And so we were allowed not just to go out of home, but also to travel regionally, so among regions, from one region to the other. And what we did as a strategy to continue to operate was obviously to totally refocus the stories. So we had lots of different stories that we were working on. We needed to change, and perhaps we'll talk about this later. But the strategy was to have several filmmakers in different regions. So we separated the nations, let's say, in different areas. And we had some filmmakers that were not Rome-based, that were based in the north or in the south. So they will be available for the reporters. So those that in our show, they just do the interview and they use one camera, but the other camera or the management of the whole filmmaking process is done by a specific filmmaker. So that the reporters could move freely across the country and find someone available for them for the interviews.
I see. Now, early on, this was a virus that we didn't know much about. It was spreading all over the world. Could you tell us about the guidelines your team established when it came to personal protection against COVID-19 while reporting? For example, early on, there were shortages of protective equipment like masks. How did you keep reporters safe?
Yes, well, we had guidelines from the company, so not just specific to our show. To some extent, I will say that we were able to have a bit more freedom because other shows were not even permitted to travel, but anyways, for us, that was allowed. As far as it regards PPEs, I will say some of them, we bought them for our own, but because in the first couple of weeks, it was quite complicated to get that. But then our company started to have continuous procurement lines. So this started not to be anymore a problem. And we were very, very serious about this this matter. So, for example, one typical thing that was always done was sanitizing the microphones, the clips, sanitizing the cameras, sanitizing the every part of the equipment, also the hard disks, as Lucina will explain you later. Since we had bulk data, it was very complicated to transfer through FTP. So we had this separation of the staff working in the editing rooms and in the desk rooms, and the staff going out to film, to interview. So they never met each other unless like with lots of protection, and always the equipment and the hard disks were sanitized. So the reporter, as Lucina, she usually brought, she was used to bring her hard disks to someone at the entrance of the company premises, sanitize that, and then they will put inside the editing machine, and someone else will do the actual edition, the actual editing on her, through her guide online. So she was used to somehow have someone working for her in the editing room.
I see. And you know, with all your reporters, you mentioned that you divided up your reporters into units, like each of them in the different regions of the country. And how did you manage, now you're not sharing a studio together, how did you coordinate a remote collaboration with the reporters in the regions? What were steps you took to make it a working process for actually producing a story?
Okay, let's say that in our show, we have we already have a certain level of independence in production of the segments. So there's a team, a coordinating team here in Rome that knows what stories are incoming. And so, or we assign those stories. I'm part of the team, or sometimes we assign specific stories. So we were already used to have teams working in not knowing what the other colleague is doing. So in this case, it was not very difficult, because basically we just brought to an extreme this kind of working style. So I can say that basically, especially in the beginning, we had in the first couple of episodes, we had lots of different segments that were produced at the same time. And then we took the best for those that were more fitting for the very acme of the crisis. And we published, we aired that in the first couple of episodes. Then later, we were able to have longer segments, so like 40-minute stories, 50-minute stories.
I see. Now, Lucina, you were up north in the hot zone, which, you know, many of us, we were kind of watching what was going on in Italy, and I couldn't imagine reporters in that area with a very incredibly high infection rate. At the height of the pandemic, did you conduct any in-person interviews or go out to record live footage? You know, Aldo told us a bit about the safety guidelines established, but what did that really look like when you were out on the field? How did you make decisions about going out reporting safely?
Hi, hello everybody. So first of all, as you can imagine, this was my first pandemic. I think it was the same to all of you. So here in Italy, we have to upset the whole work. So at the beginning of March, I was covering different stories like climate changes and how weather forecasts are deeply related into economy, or for example, the algorithms behind certain application. I had just come back from Amsterdam when our government decided to impose a first lockdown. So for a human being born in 1985, this was a never heard word, such as quarantine. So thanks to our editor-in-chief, our journalist, the entire team had to redefine our work in just a week. So it was enough thinking about our work considered as an essential service. That means we continue to move around even during the lockdown. So we gave ourselves some simple rules in order to ensure continuity of our program and to preserve the broadcast. So the first rule was take care. That means don't forget your follow-on contacts, do no harm to yourself, do no harm to others. So for example, if you live with your family, your husband, your wife, children, or older relatives, think about them, think about it. It's the first rule on which our chief laid emphasis. So, for example, my mom, who lives 115 kilometers far away from me, decided to come and stay with me for just 1 or 2 weeks in late February. Then, when the lockdown was imposed, she had to stay with me for 3 more months. But, and it's just an example of what was going on, I could go on working as well as traveling all over Italy using personal protective equipment. And of course, with a well-based plan B. So if necessary, I was sure to have a personal room around a private restroom in case of infection. So in the first week of lockdown, I was covering the impact of the pandemic on an Italian region whose health authorities have been put under an external commissioner just because of a health scandal that wiped out an entire local political class. So I visited some hospitals and talked to many doctors and nurses about their difficulties, the lack of PPI, while the number of COVID cases was increasing. So no trains, no public transport, but I used to move with my car, driving lots of kilometers every day with a filmmaker. So we used to wear PPI like face masks and disposable gloves also inside the car all day long. And in the early times, we decided to move every day and come back home every night. And we used to record the interview outside using a mic stand instead of normal microphone and using a lot of water alcoholic solutions for our hands.
Could I ask a question? How did you guys manage to get personal protective equipment? I know that, like, for example, here in the United States, we had like massive shortages. So how did you get the equipment? I'm sure a lot of journalists were probably wondering this because some of them may have been in the same boat at the time.
So our production give us every time we go out, also mask and water alcoholic solutions for our hands.
I see.
Yeah.
And Lucina, so could you walk us through, like, let's say, a single day in the life of you in the north of Italy. So, you get up in the morning, and how did the process of your day go from the morning to the night?
So I'm thinking about last April when I've been involved in the contact tracing app case. So this led me to travel a lot, and thanks to our National Public Television Task Force permission, every day I have to fill a form every single day because there were lots of checkpoint police in every crossroad. So for example, I happened to be stopped several times in a day because I used to travel driving from Rome to Milan and then to Turin for the night, sleeping in a hotel. And besides using PPE and maintaining social distances, during the lockdown, we also had to think about our lunch and dinner in time because almost all restaurants or hotels were closed, as well as takeaway or pubs and coffee bars. So we had to take some time to go shopping in markets or in order to buy waters and food for the whole day. And as Aldo told to you, once the shooting and recording were over, I came back home, and before entering, I used to take off all my clothes, have a bath, and turn on the washing machine, because I don't want to entering home with the same clothes of my working days. And after the cutoff of the recording and the interviews, we decided not to enter in the editing room. So Aldo already told you, because we have to preserve the staff room from any infection. And we also do the editing in smart working. So I used to write the script and send a copy to the editing and work with them via Skype or Zoom. And this was my, my day during the lockdown.
Now, I take it you were working also quite long hours, right? It was like really day to night. Now, something I'm a bit curious about, because Report is an investigative outlet and you mainly focus on really accountability stories during the pandemic. And this is a question for both of you, so I don't know who wants to go first. But how did you go about identifying the best and the most important stories to work on during at the height of the pandemic in Italy? I don't know if maybe Aldo wants to start.
Yes,
and then Lucina.
I will start. So as I said, we already had a set of stories that were prepared to go on air, but that in March were totally out of context and no one will care about, because there was war in the streets. There was war everywhere. So what we did is to use this kind of principle to find the guys in charge of every single issue that was not properly managed. So yes, to make them accountable. So since that is the basic of our format, we did this basically from the beginning. So the WHO, the Italian Ministry of Health, the regions, and at the level, at the local level, with hospitals, with single hospitals or single local government units that were in charge of healthcare. So we identified several stories related with the procurement, the management of the patients, for example, at the very beginning, there was cover-up of cases. One of the stories was a private hospital that probably had one of the very first identified cases in the country, but since it could have been a huge mess to manage it, they purported it was not COVID. And so they also prevented paramedics to wear PPEs, not to, scare people. But on the other hand, we went up to the WHO because some of the WHO officials are Italians, and especially at the high level. And we noticed how they were involved in previous failure to prevent pandemics, and they were promoted to WHO. And another part of the story was for us to coordinate very carefully with physicians or people that were specialized in virology, or in order not to do any little mistake, because we are lots of enemies, and if we do a mistake on sanitary matters, they will tell that we are, they will take advantage. And actually, we work on that part very carefully. And in fact, one of the items we reported on was the guidelines, both at the WHO level and national level, on the identification of suspect cases, on the management of COVID cases, which was flawed. There were lots, especially in the beginning, there were errors in that. And another story where we went to find the guys in charge and make them accountable was the procurement, which was not very difficult because there were companies that were, before the COVID-19 crisis, they were trading wine, very good Italian wine, and then they started to trade in face masks. So
And what about you, Lucina? You were out in the north. How did you identify stories to sort of contribute to the reporting? Because I know either like you have like tips from sources, or did you actually go out and decided I'm going to go looking for them?
Now, in the first part, we would like to cover the main part of the territory, so the north or the center, in the center part of the Italy, or the south. And after that, the simple agenda of led me to talk about contact tracing apps. So as I already told you, in maybe since April, I have been involved in contact tracing apps because it was not only an Italian matter, but a European one. So, and I used to talk with several researchers and experts from all over Europe and all around the world via Skype, recording also interview with them. And it was, but it's already a very important issue because I'm looking for the answer. I'm already looking for the answer. So the story is already an open case from the pandemic to nowadays.
What did you find out about the contact tracing app?
Then, so the first question is the right way to have manual contact tracing using a Bluetooth app? So as already told you, I'm already looking for the answer and I'm still working on it. The second question is, are Google and Apple working without any double purposes?
Mm-hmm.
So what do you think about that? And is it okay if our governments, European governments, give so much power to these two big tech companies? Are they monopolizing our data? And what kind of data is Google collecting via Bluetooth if you have to turn on location to let the app work? So this is already an open case and I'm looking for the answer.
So you were checking out the issues involving the big tech company, our privacy and contact tracing. That's quite a good story. Now, I know, Aldo, you told me in a call that one of the biggest exposés you put out on Report concerned the government's National Pandemic Prevention Plan, which was established before COVID-19. Could you tell us a little bit about the story? Importantly, how were you tipped off to the problem?
Sure. So first off, let me tell that this was one of the ways that we, let's say, shifted from stories done in the territory, so going out, to stories done, researched in your room, because we were forced due to the crisis to have less interviews. So one of the things that we noticed in the beginning is that Italy, as actually every country of the world that signed the 2005 IHR, International Health Regulation with WHO, they are supposed to provide and to update a pandemic prevention plan. So the update should be done every 3 years, every couple of years. Unfortunately, lots of countries, not just Italy, but lots of countries, due to the 2009 failed pandemic, let's say, with H1N1, they thought this was going to be another just round of flu, and it's not a flu, we know that. So unfortunately, lots of countries, they overlooked their responsibilities and didn't update the plans. What was big in Italy is that this was not updated since 2006, but all authorities, they lied to the ECDC, the European Center for Disease Control. They said that it was updated in 2010. And also one of the big wigs of the WHO was a former Director General of the Prevention Department of the Ministry of Health and was in charge of updating this document. He not only did not do that, but he told us, I've updated this in 2016. Again, I said it was 2006. He said to us, and also threatened us with a lawsuit. Well, what we did was very simple. I went through the whole story of the file on the website of the Health Ministry, and I gathered the metadata, and they said the file is being produced in 2006 and is not updated since 2006. And then I went also further to an analysis, a textual analysis, and it was funny because there were part of the text that said, we need to complete the vaccine stock in year 2006. So it was clear that the document was written that year, and they didn't even take, you know, the effort to change a single sentence. So when we reported on that, that created a huge mess because, you know, that was international because it was hitting the director adjunct of WHO, Mr. Ranieri Guerra. So what I can say about this type of reporting is that it was based on data, on metadata analysis and on extraction of the history of the file through Wayback Machine. So that was done at home, but it was very, very effective.
Wayback Machine is such a great resource. For those reporters who aren't familiar with it, it's basically you have access to the Internet Archive, and when people take down web pages, you can actually see a history of old web pages. So Google Wayback Machine if you haven't checked it out yet. Another one of the stories that you told me about concerned hospital mismanagement, and this happened before the lockdown. Either Lucina or Aldo, could you tell us about how you got that story and what you uncovered?
Would you like to go, Lucina?
No.
Or do you want to tell it?
Where I will go. We were tipped off. Obviously, one of the things that we did was to be very attentive, to be very in search of sources in the medical field, and there were tons of people writing us emails or contacting us directly because especially paramedics or doctors at the beginning, they didn't have PPEs, or in some cases it was terrible. They were forced not to wear PPEs in order not to scare people. So this story that I told you was I already anticipated a bit before. It was a bit like that. So there was a private hospital. They feared that a mess was going to happen if they revealed that they had a potential COVID-19 cases. And so they moved around different clinics of the same company, and they didn't let paramedics use PPEs. So this was one of the stories. We did several stories like this, and we were mostly tipped off by you know, paramedics, doctors,
And patients who are talking to you. Now, you mentioned to me about the mask supply chain, how there was a trading company that was once trading wine, suddenly started trading masks. How did you find these companies? Again, was it a source that tipped you off? Did you bump into it accidentally? How did you manage to find the companies that were scamming people?
What we did is that we looked into the list of the companies that were allowed to enter the tender for face mask procurement, and we did a screen, X-rays. We X-rayed them, and we saw that some of them, they were curious. Again, there was like a wine company. And then we studied their commercial reports to see if they had enough you know, money, enough financial stability to really be able to conduct trade on an international level, because most of the PPEs were sourced from China, and obviously everyone was there trying to make lots of money on the margin of profit. So what we did was a really thorough X-ray, a thorough screen of the financial situation of these companies and of the individuals. So we found some curious individuals that, for example, were enlisted in the ICFJ's leaks, offshore leaks. And so we started to wonder why they were in face mask procurement. That was, so we started on our own. We really went out to check the list of the guys involved in the tenders.
Now, I'm going to actually throw this question at Lucina as a reporter on the field. One of the questions we tend to get from a lot of reporters in different countries, because like, for example, Italy as a European country, you have the good fortune of having a lot of access to public information. But some reporters tend to ask us, well, if our governments don't publish tenders, don't publish procurement contracts, don't publish any of this information publicly, how are we able to get that story? What is some advice you would give, Lucina, to those reporters who don't have access to public information?
So one of the first unclear case for contact tracing app is that a government task force decides to choose only one company to roll out this app. But at the end of this phase, I and other journalists find the documents, and we saw that the task force have indicated two companies and two different contact tracing apps, but the government chose only one app. So we are already looking for this answer to why the government chose only one app and only one company. And so the Unclear is also on data. So we don't know how many people really are really using our contact tracing app. So every maybe 2 times in a month, the government tell us that we have 6 million people have downloaded the app, but how many are really using it? So another important thing for me is that in emergency, you can really do whatever you want. So for example, if you look at the GDPR or European protection privacy guideline, so we have to do a contact tracing app based on Bluetooth and with no GPS data. But if you look at the single regional app that every region have done in these months, you can find apps that use location and GPS data, and they don't really know where is GDPR. So I think this is our key point. We have to know how many people are really using app and which kind of data this app collects.
So if you can't get the national data, then go local, go regional to get that information. What about you, Aldo? What's your recommendation for reporters in countries who don't have access to public information?
Yeah, I will say that it's to look into the contradiction of the narrative of the government, because I think in that case, I'm pretty sure they will have contradicting voices even in the same government, because since this is a very complicated matter to manage this kind of pandemic, I think it's possible to work with those contradictions and make them explode in your story. Also, I will say that in countries where you don't have lots of data published, there's still lots of news that you can get from, in this case, perhaps good news or interesting news that you can get from social networks, because sometimes I think personally I'm used to spend lots of times for family reasons in the Philippines, And there you can gather lots of news from Facebook because people are addicted to Facebook. And perhaps someone will report on their Facebook some things that the government wants to cover. So what I think is that obviously we cannot rely on users. We have to, to put our filter as journalists, as professionals. But I'm pretty sure that with a smart access to social network information, you can gather some stories that the government doesn't want you to know.
Excellent. And
can I add, sorry, Stella,
yeah, go for it.
For what concerns contact tracing app, we have to thanks a lot GitHub, because on this platform you can find really too many information about privacy of these apps or the algorithms, and so that I didn't know before. So
you actually like opened the app information in the App Store to get that information?
No, it's something like it's platform for maybe engineers or others, but you can understand something important. So
excellent.
It's a good thing. Yes.
Excellent. And sort of a wrap-up question before we get to audience questions. If you're in the audience and you have any questions, please ask them now, because we're going to get to them in 1 minute. So, from your experience this year reporting on the pandemic in Italy, I want each of you to give an answer to this question. What do you think is the most important lesson you learned as a reporter, reporting under these circumstances? Maybe Aldo wants to start.
Yeah, I'll go first. So, well, for us, it was to reframe stories, to work with a very open mind on scheduling stories. So we are used to prepare stories 4 months before they get aired, even more actually, 5, 6 months, because it's investigative reports. So that takes lots of checks, double checks, in order not to get lawsuited. In this case, we needed to work much quicker than usual. And so what we did is that in some cases, we reframed. We had the stories. We had the story on the consumption of meat sourced from the Amazon region, and then it was connected to the level of deforestation implied in pollution tied to COVID-19 spread. So we tried to reframe it. We had already lots of footage. We reframed it, trying to connect that story to the COVID-19 spread. So what I will say is always try to see how you can repurpose, reframe your story, and drink lots of coffee.
Drink a lot of coffee. Lucina, what is the most important lesson you learned?
So I have already told you, I consider this as an essential service. So I think it is an honor for me to tell my country in a so dramatic period. So reporting COVID, reporting our city, I can only remember our cities with no people in the streets, no everything closed. I think it's an honor for me to tell our people this dramatic period. So this is my lesson.
Yes. So we have a couple of questions from the audience. This question is from Kunal. And Kunal writes to us, Italy really stood strong from the day the outbreak began. And now when the country has normalized the pandemic situation, how would you characterize the measures used to contain the spread of the virus? I suppose this is a bit of an opinion question as citizens and journalists in Italy. How well did you think the government did in containing the pandemic?
You want to go, Lucina?
I think we have to pay a lot of attention, because I was in Dublin last week, and 10 minutes before the Irish lockdown. So I used to see too many people without PPI and without mask. It's not so good. I'm a little bit afraid for Italy too. And so I think we have to pay more attention. Our governments tell us to wear masks and to maintain social distances. So I think for not only for our job, but for the entire country, it's important, because our lockdown is now looked as so good for the numbers of the cases, no? What do you think, Aldo?
Well, I think that due to lack of prevention, what has been done is good. But if they had put in place all the measures that could have been put in place for prevention, perhaps we would have not need to put on lockdown the south of Italy, because we should not forget that a lockdown means ravaging of economy, destruction of economy, and also it's a huge restriction on basic rights of people. So I will say that in the very beginning, everyone downplayed too much the extent of the potential pandemic, but then when the mess was already done, when we were already in state of alarm, I mean, everyone complied. Italians were very attentive to public health, to PPEs, to social distancing. So it's funny because it's quite the contrary of the usual narratives on Italian, you know, like messy or anarchist people. Actually, everyone was behaving like a German.
Yeah, and I remember something you mentioned about your story on the pandemic prevention plan. You had mentioned to me that out of the 35,000 deaths Italy had suffered so far, had they actually applied that plan and updated it, that 10,000 lives could have been saved, correct?
Yeah, that's correct. This is an estimate, obviously, and it has been done by a former military general that is specialized in NBC defense, so it is really very much into this kind of issues, and he conducted an independent research that is now in the hands of district attorney of Bergamo, who's basically covering all the mismanagement in the very beginning, in the first months of the epidemic. So yes, according to this estimate, 10,000 lives could have been spared if the pandemic prevention plan would have been updated. Now I will explain why, because this can be interesting to other colleagues everywhere in the world. As I said, that's sort of mandatory. So every country that has signed IHR 2005 with WHO, they are supposed to update that. When you update a pandemic prevention plan, that means that you really scan the territory and you see how many intensive care unit beds you have in that region, and if you need more, or if you are understaffed with, for example, ICU, ICU doctors, or, for example, this is very important, it was totally missing in the beginning of the management in Italy, we didn't have pre-triage. No one had pre-triage. They started to put in place pre-triage only a few weeks after the crisis had begun. So in the very beginning, one of the first place of spread of the virus were hospitals. Now, it was very simple. If a pandemic prevention plan was updated, they will know that you have to have pre-triage at least in every city. So the guys that think that they might have COVID, they go there. And so I'll say that it's very important because the pandemic prevention plan, they are fed with data, with information that comes from the regional healthcare units. So it's you see the whole chain of mismanagement. No one in the regions updated, no one on a national level, and obviously no one that was really making sure or scolding them from the WHO or other international authorities. So I can say, for example, that in this case, we have also reported on a local level. So we contacted all the regions to try to understand when they updated last time their pandemic prevention plan, and no one of them, they updated that like later than 2008, 2009.
So for the other reporters who are tuning in or who will be listening to this recording later on, it might be worth checking if your country signed on to this agreement and to check whether your country had a pandemic prevention plan and how that actually turned out. Another question here we have from Anne. Now, I think a lot of us are suffering pandemic fatigue. This pandemic has been ongoing now, for a while. And, many of us, even as reporters, are getting a bit tired of reporting what feels like the same story, right? And she asks, what stories are you working on now at Report? Are you still covering the pandemic, or have you moved on to other stories? I don't know if Lucina wants to answer this one.
I'm trying to go in depth with COVID tracing app. So I think the other question is for me, but let's
Aldo expand.
And yes.
Oh, just I'll be very quick on this. We're keeping like 10%, 15% stories on COVID, and the rest we are trying to go back to usual bad guys.
The usual bad guys. Excellent. And this one is from Kunal, and I suppose this question is for Lucina. Were there any instances in Italy when people were concerned about the anonymity of their privacy while using contact tracing apps?
Definitely, I think yes, because you have to think that only 6 million people have downloaded the app. If you compare this number with the Germany experience, in which 20 million people have downloaded the app, maybe you have to assure that, yeah, we have in Italy too many concerns, because if you think that since we don't have data, I have calculated that with a professor that only 1% of people who have a COVID positive test have downloaded the app. So is it working for real or not? I don't think so. I don't think so.
I see. Well, if there's no more questions from the audience, we're going to wrap up. Does anyone have any other questions that they would like to ask Aldo or Lucina about reporting during lockdown or reporting on COVID-19 in Italy? Oh, going once, going twice. All right, going 3 times. I guess we're going to call that a wrap. So I'm just going to give these remarks just here at the bottom. Thank you so much for joining us today and offering the lessons of your experience reporting in Italy during the pandemic. And for everyone who is joining us either here or via the live stream, I want to remind you that on Monday, October 5th at 7 p.m., we're going to be holding our Tribute to Journalists 2020 this year. It's free for the first time ever. So please go to www.icfj.org to register for the event. We're going to recognize CNN's Farid Zakaria for his thoughtful insights and expert analysis of the most important stories of the day. Our Knight International Journalism Award winner, founder and editor of Mada Masar, Lina Tala of Egypt, and Russian reporter Roman Anin, who will receive the ICFJ Knight Trailblazer Award for launching a collaborative investigative news outlet called iStories in a country where sources of independent news are increasingly rare. Molto grazie, Lucina and Aldo. Really, thank you so much for sharing your wisdom, sharing your stories and experience in Italy.
Thank you for your attention.
Please stay safe, everyone, and we'll see you next time.
You too. Take care.
Take care. Bye.
Bye. Thank you.